Not all cancer patients have to undergo chemotherapy, but many who do often see a certain irony in this particular type of treatment.
In cancer, it's very different than it is in many other diagnoses. If you have pneumonia, for instance, and you have a high fever and a cough and you feel terrible and you go to the doctor gives you medicine that makes you feel better. It's very different in cancer. I mean, you feel pretty good usually in the beginning. Maybe you have a screening test that shows something, or a little blood in your urine, or you're in your stool, and then all of a sudden you become a cancer patient who gets many, many toxic treatments. And at the end of treatment, you feel far worse than you ever have felt in your life, usually.
In general, chemotherapy works by killing cancer cells. Sometimes healthy cells are killed along with malignant ones. It's this friendly fire that accounts for many of chemo's unfavorable side effects. Not everyone on chemotherapy suffers negative results, but most do. Fatigue, changes in weight, flu-like symptoms, hair loss, and digestive problems are bad enough, but many patients say nausea is the most debilitating.
The nausea is brought on by several different effects. One can be direct killing of GI mucosal cells, or two, it could be because of, as the tumor cells die, they release hormones which then go to the brain to make patients feel sick.
Fortunately, there have been advances in treatments that can soften the blow of chemo. Among them, a new medicine that combats queasiness by blocking the hormone serotonin.
That was actually a breakthrough drug. It revolutionized chemotherapy. Prior to this drug, many chemotherapies had to be done with the patients in the hospital because they became so sick. And since that drug was approved, patients are getting chemotherapy as an outpatient.
Today, there are a host of drugs that combat nausea. Some in pill form are taken after therapy, but many are given intravenously prior to the chemo drugs themselves. And there are simple things patients can do in addition.
After chemotherapy, we tell patients to stay away from anything very spicy, which can upset one's stomach, and also try to stay away from any foods with very strong odors, because that tends to make people a little queasy as well.
The search for a cure is still ongoing, but early detection and a greater variety of treatment options have granted many cancer patients not just more time, but more quality time. For WebMD, I'm Damon Maharg.